You're listening to the Brave Parent Podcast. I'm your host, Dr. Susan Maples. I'm here for all parents who deeply love their children and want their health span to equal their lifespan. In other words, to be healthy their entire lives. If that's you, tune in. In every episode, we're grappling with contemporary issues that affect every child every day in areas that your doctors either don't know or don't have time to tell you. It's your time to be brave. Hello, everyone, and welcome back to the Brave Parent Season 2 podcast with my co-host, Lauren Eckert, who is the founder and CEO of Burning Soul Press and one of my, I would say I'm one of her biggest fans. I hope so. Anyway, I hope you've been enjoying the podcast, and today we have a real treat for you. Dr. Mark Cannon, who in my world, the world of oral and systemic health, is really truly a celebrity. Everybody, and he knows it. I think of him as the nutty professor because he's being nutty. He is literally a pediatric dentist by original training. But you'll see that today, while we might be talking about pediatric dentistry here and there, this is far from why he has become a leader in our profession. He is a consummate researcher, learner, delightful, quirky, funny, and interesting in every way. And he's been leading us in, I'm actually outgoing president. Mark is incoming president of the American Academy for Oral and Systemic Health. And he's been leading our organization and several others around the world with news of the microbiome, which is gut health, which, as we've already discussed earlier in digest sections of the book, of Brave Parent book, really the up and coming hope for a lot of allergies and autoimmune problems. The whole work everybody knows about probiotics, but what do you really know about probiotics? And what about for babies and kids? And what about oral probiotics versus gut probiotics? How do we impact long-lasting change for gut dysbiosis and issues like that? So, Mark, say hello. And
hello, everyone.
tell
Thank
us
you
a
for
little
that
bit about.
wonderful introduction.
Oh,
I really appreciate it. The gift card will be in the mail.
back at you. Thank you. Mark is on the brink of retiring from clinical dentistry in order to do more leadership and teaching, and he is all over the world. Give us a quick synopsis of where you've been in the last month teaching.
Oh, well, since I retired October 31st at 11:59 p.m., I haven't really been home. And the joke was on Black Friday, because I flew back from Brazil on Thanksgiving, that Black Friday was my first day off since I retired. And it was really true because I was at the Global Initiative in Rome. I had a paper there. I was chairing a research poster presentations that were being done. And then I was back one day, and then I left for Brazil, where I lectured for 2 days and we set up research for 3 days. And then I came back on Thanksgiving, and my luggage came back that Sunday.
So here you are.
Vacation for the luggage. So I'm
Yeah,
leaving today to go down to Florida.
Mark has a big family, but he literally is just a robust, energetic, vibrant contributor, and so he just never stops. The Energizer Bunny. So, a kindred spirit in that way.
And that's true. And with my family, and I know I mentioned this, I 5 kids and 3 grandkids and 2 more grandkids on the way. I took them everywhere.
I
I
love
took
it.
them everywhere. They were babies, and they were flying everywhere. Small kids going to Egypt, you name it, Spain, Rome, Dublin, London, Stockholm, Brazil. They've all been to Brazil, different areas of Brazil. And the Brazilians were all saying, what's Michelle up to now? Thinking about 20 years ago when she was little. Well, she's a pediatric ICU nurse, married, and she has a baby on the way. And they go like, wow, so much. Yeah.
So cool. Well, tell us a little bit about let's start from the very beginning. Let's start
Mhm.
from birth. and talk a little bit about the microbiome, because the claim has been, and we still sort of stick to it, that we're born with a relatively sterile gut. And yet the research is showing maybe not so sterile. The population of the microbiome in a baby's gut, for an adult, we have about 3.5 pounds of bacteria in our gut. The more diverse, the better. We've been shrinking in our microbiome diversity, which is not helping us. And introducing good gut bugs by probiotics are something we're sort of familiar with, but you've seen lots of GI issues and changes in our population, and we have all seen them. When we start with a healthy birth, vaginal delivery, let's start there. Talk about population of the mouth and the gut from birth, Mark.
Great. But let's go back a little bit further.
Okay,
Go back
prenatal.
to work of Kirsty Argard from Baylor University. She's a very famous fetal maternal OB-GYN researcher. She was one of our speakers for the AOSH meeting that we had in Minneapolis. She's been in front of the Nobel Committee. I actually attended her presentation in Stockholm at the Nobel Assembly.
Cool.
She's done a lot of great research, but babies are not born sterile. They're born with a microbiome. They get more microbiome from the vaginal delivery, but there's a placental microbiome. And the placental microbiome is actually set up by the oral microbiome. That was great research of Kirsty Argard. What sets up everything, making it recognized as the gateway, the number one gateway, there's others, but it's the number one gateway microbiome, is the mouth. Yeah, that's where everything comes in. Water, food, and some people breathe, shouldn't, but it goes in through their mouth. So you see so many things can go in there that of course you had to have a gateway microbiome. You had to have the friendlies, the commensals, the beneficial bacteria to defend you, because we evolved that way, and the microbiome adjusted our evolution. It is what they call a holobiont. We are one giant creature. I describe it, you were talking about cruise. I describe it as a cruise ship. We are a cruise ship. And on us in our cruise ship, we have a crew, 37 trillion to 39 trillion microbes. The
That's
crew is crazy. They do a lot of our work for us because we evolved that way. We gave up the capability of doing many of these things because it was redundant. We had the bacteria to do it for us. Nature gets rid of redundant things. If you don't use your arms and legs over a period of time, they become flippers and you go back in the ocean. I mean, nature gets rid of things you don't use. So we have this defensive mechanism that we have evolved with. Our immune system explains all the problems with allergies and psychological issues, which is even more important. We have to talk about the importance of development. Mental development depends upon your microbiome and key neurotransmitters. As you know, that's been part of my research that I presented.
Yep.
Some very important research on it. So let's go way back. It all occurs even before the mother is pregnant, because Kirsty Argard also showed that even antecedent history, a history of having had antibiotics 2 or 3 years before the pregnancy, affected the placental microbiome.
Isn't that crazy?
It's crazy. Now, Joseph New is another famous neonatologist who did all the work on looking at the placental microbiome too, and showed that periodontal pathogens, gum disease pathogens, had this innate ability to get down into the placenta. And I know you know this, Susan, very, very well, that preeclampsia is related to a gum disease. Preeclampsia is caused by a gum disease bacteria, and they have proven that by taking that bacteria from women, pregnant women who have preeclampsia, giving it to pregnant mice, and those pregnant mice get preeclampsia. The ones that get it from the moms who don't have preeclampsia, don't have the hypertension, they don't get it. The mice don't get it. So
We've even seen stillbirth from bacteria delivered from the mouth, where previously we thought it was just from the colorectal or vaginal canal. And when we're able to use DNA of the bacteria itself to identify the species, we find that this particular species, Fusobacterium nucleatum, which infected this infant, came directly from the mom's mouth. And it wasn't even periodontal disease, it was just pregnancy gingivitis.
Right, right. It was not severe at all. It was, and this is a thing that the studies have shown. You don't have to have bleeding gums to have the infection because many of these bacteria, we call them IBPs, they live within your cells. They
What's
penetrate in
IBP stand for?
intracellular bacterial pathogens. They're classic, like with Lyme disease. But all these gum disease ones, they go within the cells and they live within your cells like little parasites. So they call them pathobionts because they kind of go in, they form these clusters. Viruses do this too. I mean, SARS-CoV-2, you can see cells loaded with clusters, the SARS-CoV-2, and they grow in there and they turn off the death of the cell. So a cell doesn't go through apoptosis. It stays alive to be a bacteria factory.
And the bacteria
High
just
tech.
multiply. They make a little pus pocket inside the cell. Isn't that crazy?
Yeah, they make this little growth, we call them phagolysosomes, and they get near your mitochondria, which is the power source of your cell, and it causes it to leak. And this is what they call the danger signal. Now, shockingly and not surprisingly, that's being linked to cancer development too. There's some crazy articles in oncology journals and on medical hypothesis about are these cancers being caused by bacteria getting within the cell and the genetic material taking over the growth? Because when the bacteria get too much within the cell, they shut down the mitochondria, and that turns the cell's metabolism into one that is exactly the same as what you see in cancer cells. There are too many red flags, the old expression. There's so many red flags. I think I'm in Moscow on May Day parade day. There's so many red flags that you go like, there's something there that we have to look at. And that's why the probiotics, and fecal matter transplants and prebiotics are being looked at so much in cancer research. A lot of the probiotics we have are not that effective,
Right.
and the best probiotics out there aren't out there yet.
Of course. I keep saying to people, probiotics right now are like BBs against an iceberg, but the promise is huge.
Yeah, there are good ones out there, but the really great ones, in fact, just a few months ago, Amancia is called Amancia, short for Akkermansia muciniphila, but Amancia became available as a probiotic, and that is a probiotic that seals leaky gut. If you have any symptoms of leaky gut, Amancia is famous from research that was done in the Netherlands and Amsterdam, where they showed it was one of the key factors in obesity, and in diabetes and overall health and all the symptoms of leaky gut. It is finally available. I think that research was done like 15 years ago.
Is that a brand name or a particular strain of bacteria?
It's called Akkermansia, but the genus, people abbreviate it as Amancia. It's just
So
easy to
it's a
remember Amancia. It's
bacteria.
actually a bacteria. Yeah.
Yeah,
It's not a brand name. The
very
company that sells it is Pendulum. It's pricey right now. I'm hoping for lots of competition to drive that down
yeah.
quickly.
Now 1 in every 20 kids has common food allergies. Like it's unbelievable how much the allergy world has skyrocketed, all attributed to the decrease in the microbiome. And there are several causes for that. But can you talk a little bit more about how parents can impact healthy microbiome in infants? All the different ways from C-sections, antibiotics, diversity of food supply, anything that you can think of that would help parents reduce their risk of the atopic march, eczema, chronic rhinitis, allergic food allergies, seasonal allergies, all of that.
Oh, there was some brilliant research first done at Northwestern and at Indiana University by Joe Mills Cook on the effect of something called SLS. It's a soap surfactant. It's in a lot of soaps. It's in some toothpaste. I tell people avoid SLS, sodium lauryl sulfate. They would create allergies in mice for studies by rubbing their skin with SLS and exposing the skin to the food allergen.
Isn't
So
it like in every toothpaste?
it's in a lot of toothpaste. We tell people avoid it. There's a lot of good brands who don't have SLS, but you got a little kid who's having their erupting teeth brush with a toothpaste with SLS, and then they eat, and then they get a food allergy. You have to say to yourself, "Wow, I wonder why," because that's how we create food allergies in experimental animals. So and so it's
That is
absolutely crazy.
terrifying. I mean,
It is terrifying, but that's why so many brands actually show on the front no SLS. And the FDA has been working for years to remove it from shampoo and from skin products. But if you've been around, you'll remember the scandals on SLS going back decades ago because they put SLS in women's shampoo because it would create split ends and frizzy hair. And SLS will actually take your normal hair color away. So women's shampoo always had higher amounts. This is true. You can look up all the scandals on
Buy
it.
more hair product that way.
You have to buy more hair. You have to buy the conditioner and the hair coloring products. And they tried it with men, it didn't work. But they go like, oh heck, well, just keep putting more of it in women's products. And there was some really bad scandals, published scandals.
Well, and not only that, but SLS really does promote dry mouth,
Oh
which
yes.
a lot of people who take medications have dry mouth, and that's a really devastating thing, not just for the microbiome, but for cavities and for fungal infections.
Mhm.
So, wow, sodium lauryl sulfate has been around forever, but it just seems like it
It's
never goes
cheap.
away.
It's
Yeah.
cheap. That's why it's a very, very cheap product. I mean, it's something that's very cheap to
Emulsifier?
buy.
Is it an emulsifier? Why do they need to put it in
It's
there?
a surfactant. It just makes bubbles. And
Oh,
some of the toothpaste companies have said that they want to cut back on it, but when they do focus groups with consumers, the consumers say it doesn't bubble enough because people have thank SC Johnson and scrubbing bubbles. You have in your head that bubbles clean. You'll
oh
never
my
get that
gosh.
out of your head. It's there forever. And we had a brilliant speaker one time who went through all the stuff that she used to do for this big marketing company on implanting things in your head that will never go away. And
Oh my
scrubbing bubbles
gosh.
is one of those. They'll never go out of your brain. And so you see bubbles, you think it's cleaning more. In reality, you're diluting your effective product, whether it's xylitol or fluoride, you're diluting it, and the kid's far more likely to swallow it. I mentioned I was in Brazil, and some of the brilliant researchers who worked on how much fluoride it comes out of the urine on kids swallowing toothpaste, they're horrified at how much kids swallow on toothpaste, much more than people expect, but they can actually check that. But going back to babies, because we see how easily I digress.
Oh yes, me too.
Yeah,
With
I know.
flows.
but that
Which
was
by
amazing
nature, we just
information, though.
get fascinating. I know. We could talk
But
for hours. Let me tell you, this guy's incredible.
babies are programmed to cry if they become hypercapnic. So if they get too much CO2 because their nose is plugged, if they're not breathing well enough through their nose, then they are programmed to start crying. So babies who cry a lot at night may very well already have airway issues. As you know, by age 1, 20 to 30% of kids do have sleep disturbed breathing. So it's not uncommon for babies who are like cranky babies. And colic, the amount of babies with colic in each country is actually related to the food of that country. So there are countries where they don't have hardly any babies who are colicky. That is something we have created. A lot of it is with pouch foods. The British Dental Association just came out with a scathing review of pouch foods, which they call the amount of sugar in it as obscene. I love the Brits. They don't mince on the words. They see
I
something, they
I
come out
love
and
it.
just say it. They're not political that way.
You're gonna laugh because I just wrote an article for our local 517 Health magazine, and I wrote it on pouches and how horrible they are for facial development, lack of lateralization
Oh,
of the
yeah.
tongue and all that, right? And I titled it just to get readers, Squeeze
Mhm.
and Suck. Squeeze and Suck, not so
Effective.
much. Yeah,
Yeah,
I
but
know.
that's
I
the whole
know.
idea is that they're compressing everything
Yeah.
heavily
It's
and
supposed to be like
unnatural with a
the neatest, less messy way to feed kids, and it's just unconscionable.
yeah, I know it's really bad. And I have 3 grandkids and 2 more coming. So, I'm the grandpa who says, let's go get them something very natural and varied. You know the research going back to feeding.
Yeah.
I looked at 30 kids with autism, 30 kids from a blue zone in Colombia, and 30 kids are very, very healthy kids from my area of Chicagoland. To find those 30 very healthy kids was so difficult.
I know. That's why my book is against all odds, right?
That is, it was so difficult finding 30 healthy kids. In
Yeah.
Colombia, in the area, blue zone area, yeah, half a morning, I'm done. I find that 30 healthy kids, no history antibiotics, no history illness. We get their full microbiome. We do their mitochondrial health. We come back. We use AI. We look at all the RNA. Now, RNA is what produces everything. So all the proteins from the host and from the bacteria itself and from the
Where do you get
archaea.
it from the poop?
Really intense amount of information we got. And we found definitely that the kids with autism, like all other studies, they're missing key bacteria. They're missing very important ones that produce what are the precursors, the beginning of the chemicals that transmit stuff for your brain and for brain development. And they also have bad bacteria. One of them very associated with plastic. It loves to grow on plastic that actually breaks down those very essential brain proteins, those essential, what they call neurotransmitters. And so these kids never stood a chance, period.
Yeah.
And it started actually with the mom being missing some very important bacteria. That was work done out of Little Rock Children's Hospital by Shannon Rose and James Adams. By the way, I always credit the people.
I love
I
that.
noticed. I love
I
that.
always credit the people. They did the research. They deserve all the praise.
We know that bacteria transmission from moms to babies is the most critical, both
Mhm,
from delivery and then also even the mouth, like for
mhm.
instance, caries disease,
Right.
the transmissibility of what we call cariogenic or cavity prone moms to
Mhm.
babies in a window of infectivity of young age, like 6 months to 3.5 years old is like considered that window. It's crazy to think that all this time we didn't realize that these indigenous normal healthy bacteria, which are so critical for health, make a difference. We're all out to demonize bugs. Bugs are bad, and COVID made it, talk about what gets in our brain,
Mhm.
sanitizing our world. Talk about clean versus dirty, and like hand sanitizers and soaps with antibacterials and rinses that says kills 99% of all bacteria. How good is all that for our bodies? These
Oh,
extra.
it's horrible. In fact, you probably saw not too long ago, there was an article where they looked at healthy babies born in this area of Africa, the Hadza tribe, and they have 23% of the bacteria those babies have are novel to them. We don't have them anymore. There's been many a study done looking at hunter-gatherers in Africa, comparing them to kids in Europe and the United States, and we killed off so many beneficial bacteria, creating chronic illness, autoimmune illness, and of course, behavioral issues, OCD, for instance, obsessive compulsive disorder, anxiety, depression. So in Europe, last September, I was at the Probiotic Symposium, international one with a paper, and they had a review of 21 trials done where they had done bacteria transplant from healthy, well-adjusted people to people who had psychological problems. Guess what happened?
They got better.
much better. Do they need their meds? They don't need their meds.
That
You can,
crazy?
it is crazy, but they get the normal transmitters. Most of the medications we have just keep your level normal or raises it of certain important neurotransmitters, chemicals you need for your brain. And so for it to function properly, that's what these medications do. And if you have the
Mark,
bacteria,
you touched on what's happened over time. It's estimated that we have half of the diversity of gut bugs that we did 50 years ago. That's how fast we've lost so much of the diversity.
oh, those 30 healthy kids I mentioned,
Yep.
they actually had very significant diversity, and it was over double that of the kids with autism. And these healthy kids, I have to tell you, we first would go over the health history. That was the first thing. Any antibiotics, medications, are they sick? Have they been sick? Nope, nope, nope. Really healthy. No, don't miss school. Never miss a day of school. Okay, great. Step number one, look at their BMI. Yep, looks very good, healthy. Yep, tissue all looks good. Look at their dental history. Yep, all really great. No problems there. Then we would get to the dietary component. You have to fill out the diet history.
Right.
And basically, they just, the parents were making all the food at home. They didn't eat junk food.
No ultra processed food.
Yeah, nothing out of a bag was the statement. And I love that. I go, so anytime I see anything with a bag, I go like, I can't have it. It's in a bag. That's in my mind. And by the way, I don't know if you've done this yet, Susan, but have you worn a CGM?
I have
That's a
not.
continuous glucose monitor. It measures your blood sugar all the time.
Yeah.
I highly, well, you're too young. You're
No,
way too young. You're
I
like
know
what,
I was with Doug for a
29
week.
right now? So,
Yeah,
uh,
whatever.
yeah, because yeah,
No,
you guys are twins. I remember that, right? And so anyway, I wore one for several weeks, and I was telling Dr. Golder last night on the fireside chat. It was a real education because there are certain things that really raise your blood sugar, and they
okay.
cannot be healthy for you. And you go like, "Oh my God, I had no idea it was going to skyrocket like that off that one item."
You can also see how a 10-minute walk will bring your blood sugar down.
Yeah,
Yeah.
or the anxiety you get afterwards.
That's funny.
No, actually, I noticed if I was in an anxious situation, my blood sugar would go up because I think the body was responding by mobilizing sugar because it was expecting a fight or flight, situation. So that's interesting. I have to talk to some people about that. I have in my mind hundreds of studies I want to do.
Of course. Me too. Me too. It's fascinating to me that that the gut holds so many clues that we have just stumbled upon. A little bit about the Human Microbiome Project. Um, what do you know about where we are? Because we finished like a whole. Where are we in terms of research? Like, would you
Well,
say
the
we're
the the original one, did not do the full deep dive. There was no really super deep sequencing, and they didn't have the AI to go in. I mean, it's improved a lot. Just look at Illumina and other systems out there. So we're able. That's why just a few months ago, I completed the first, it's called whole genome. You look at all the genes, deep sequencing. You go all the way down as far as you can to every last little speck of deep sequencing of the nasal microbiome, which had never been done. And there was 2,553 new species we pulled out, or I should say, I said species, a lot were strains, but I don't want to get too technical. So there was a lot of different groups that we pulled out that we didn't know were there, and a lot of them are actually probiotics that overlap with the mouth. So it makes sense because a
yep.
lot of good bacteria for us are also good bacteria for mice and rats, but that we evolved that way. They co-evolved with us for a very long time. That's one of the other things we discovered is that we share from about 200,000 years ago, a bacteria with the black desert rat, so sub-Saharan
So
African
the
bacteria.
nose and the mouth have different microbiomes with some
Yes,
strains that are the same. The
right.
same thing with the gut. the
Mhm.
gut holds a little acid bath in it called the stomach, where we literally, when we swallow bugs, that little acid bath catches some of the bad bugs so they don't go on into the gut and make a home further down. But we have a lot of kids on what we call proton pump inhibitors. They're
Mhm.
they're reflux medications. So when kids are refluxing or irping stomach acid up into their mouth, and by the way, 60% of adults also and 30% weekly have this condition, a lot
Mhm.
from ultra processed foods. But in general, when we take away that acid bath, some of the bugs in the mouth end up bypassing that acid bath and getting into the gut. What Mark knows a lot about this. Tell us a little bit about what happens then.
Well, a lot of the pathogens, the bad bacteria, they like acid anyway. And if they go down with food, they're somewhat protected. Some of them can spore, and that means they get a little coating around themselves and survive. What has saved us for hundreds of thousands of years as a species has been the fact that the good guys are also going down. And there's a coating between actually the inside of your intestines, your whole gut. There's a biofilm that is a good biofilm. It's a coating of bacteria and breakdown products and their metabolites. And they keep the bad bacteria from actually getting in and establishing a good home in your gut. They simply pass through. They're like visitors going through, tourists going through. Um, and so, and that explains tourism too, doesn't it? In more ways than one, if you draw the analogy. So the funny thing about all this is that a lot of our foods are attacking that layer. There's a lot of preservatives that actually are antimicrobial and they kill the good bacteria. And yeah, to be honest with you, if you think of always think in terms of evolution and think of survival, go back. You're a hunter gatherer. It's late. There's saber-toothed tigers, you name it, whatever around. We went back quite a ways, but we went back a ways. Dire wolves are everywhere. You're up in a tree. Are you a noisy sleeper? No,
No,
you're a quiet sleeper.
otherwise you'd be dead in the morning.
Yeah, you wouldn't, you'd be found.
Uh-huh.
They sniff you out anyway, but if they could hear you, they could really track you down. Same thing, we used to be able to eat everything, and we had to eat everything to survive. It wasn't one of those things. This is a modern dilemma that we have of gut issues, and we've created the gut issues. And I was down in Brazil, like I said, doing research. Only ate Brazilian food. And speaking of the Human Microbiome Project, I had my gut analyzed a long time ago. You could not recognize I was an American because I eat local food everywhere I'm at. I only believe in local, and
I love it.
and the Brazilians loved it too. They go like, "Oh, we love that." We go I can eat it. I have eaten street food in the street on the streets of Mexico City and not gotten sick
I
because
have rock solid stomach too, but I have avoided a lot of those antibiotics I grew up on,
yeah.
just to be really careful. I have to say, when I keep going, because I have a couple more questions, but I interrupt.
No,
Go ahead.
go ahead with your questions. Yeah.
So I mean, I look at this and think, babies come out and we dump antibiotics in their eyes right away, and we give
Mhm.
antibiotics for every such reason. When I was in dental school, they said you can't overdose on this stuff. Just give them the antibiotics, right?
Mhm.
And we see a lot of alteration, and then we notice that we are not as resilient, I guess, to be able to host good gut bacteria. And you mentioned in prenatal care, the role of a mother taking antibiotics even a couple years before can affect the microbiome. How about antibiotics in babies? And I know we give amoxicillin, the pediatricians give it all the time, and parents often insist on it.
That's the problem. In fact, I was just talking to one of the emergency physicians at Northwestern maybe a month or two ago. And he would say that parents come in insisting on the antibiotic because they said they're having a hard time sleeping.
Well, the chronic ear infections,
Yes, and the
those things.
pain and all that. I've been through that. We've all been through that. We all know people who've lost hearing. One of my very good friends, an oral surgeon, is deaf in one ear because of an infection when he was a baby. So we do get worried about it, but he always explains this is a dual-edged sword. It's going to help, it's going to hurt down the road too. Sadly, we don't have the probiotics and the prebiotics that we need yet. We can use what we have. I mean, you're perfectly fine using Culturelle.
So prebiotics, isn't that fiber to feed the good bacteria, gut bacteria, the food that we eat? Or are you
Yes,
referring to
but
something?
if anything that helps the good bacteria. So prebiotics or anything that help the probiotics. So fiber is one of the things, but there's some probiotics that live well without the fiber we would think of, like the inulin and doing the Jerusalem artichoke and all that. So yeah, it's anything that helps the good guys. And sometimes it's a supplement. It's where many of us are magnesium deficient. I mean, it's just we're messed up, Susan.
And
We're messed
parents,
up.
I know we are, and we've got to get back to being real. It's going to take a while, not in our lifetime, Mark, unfortunately. Um,
People are
when
getting
we,
more aware. I plan to live
well,
another
that's
100
true.
years.
Me
So
too, man. Me too. I'm with you. But here's the thing: we have so parents, you need to know that the number one disease among children globally is dental caries, tooth decay, and when that honestly affects 20% of 2-year-olds and a third of 3-year-olds is out of control
Mhm.
from the foods that we're eating. But here's the deal: when you get a dental infection in your mouth, oftentimes uh, across the board, even though we have a doctor of dental surgery, many dentists aren't doing their own surgery, especially on infected children. They'll refer them, and you may be waiting a while with that infection. Of course, they're going to want to prescribe. So when we look at the history of prescribing, um, dentistry has increased their antibiotic prescribing by 62%, while the rest of the medical population decreased over a 10-year period 24%. And there are reasons for that, but partly it's because we need to get infected teeth out,
Mhm.
not put them on an antibiotic for 3 weeks, right? So that's been a bit of a concern. So just to call that out, that there are ways that, you have to help physicians not by not insisting, but you also need to be able to make sure that children get treated, be their advocate, that they get treated with bacterial infections quickly so that we're not prolonging an antibiotic
Yeah,
protocol.
here's the whole thing you were mentioning because we're acutely aware of this issue. The number one reason for outpatient surgery in for children in the United Kingdom is dental. It is that severe. And at my hospital, at Ann Arbor H. Lurie Children's Hospital, we have months. It's months for you to get in and get your teeth taken care of. And these are little 2, 3, 4-year-olds with infections.
Overwhelming.
It is overwhelming. And of course, COVID made it much worse. It's been a disaster since
Why
COVID.
is that?
Yeah. It's been
Why,
a lack of
why
care.
COVID make it worse? Mark, tell us.
Oh, it's just like we had a meeting Tuesday night, and this good friend of mine, a very well-known prosthodontist, had a patient come in he hadn't seen in 2.5 years because of COVID and needs everything done. I mean, it's just the lack of preventive care and the constant snacking. When people were homebound, they would hit the refrigerator every 2 or 3 hours. Now, I went in, I worked. I didn't see that effect because I was in working all the time, taking care of traumas and emergencies and infections. So I spent a lot of time at the office, but yeah, it made it much worse. But here's the sad thing. Long-term studies have shown, I mean, this is going 27 years and longer, that these kids who get these infections are the first to have symptoms, subclinical symptomology of cardiovascular disease. So the first to get heart disease.
That's
So
something.
it is sad because you look at them in their 30s and 40s and start doing tests and show, oh my heavens, we already have thickening over the arteries. We already have the atherosclerosis. And this is true in many ways, but there's even something more horrifying to me is the assemblage, is called. The bacteria that is responsible for many of the cavities, not all of them, but many of them in young kids is called strep mutans. This type of strep, it's a bad strep. There's good strep too, by the way, lots of good strep. But this bad strep forms an alliance with a fungus called Candida. You've heard about kids getting thrush mouth and so on. They actually form what's called the interkingdom assemblage. They form, it looks like a creature. If you look at videos on the microscope, it actually has little legs that sticks out because the fungus forms these little legs. And it is like an alien walking across your tooth. That assemblage is now, the past year, been linked to cancer too.
Well, and dementia, we
Oh,
see
yeah.
Candida showing up, and it's neurotropic, meaning it attacks healthy brain tissue, and it's modal. It travels along the dendrites, and so they see the same assembly in the brains of these Alzheimer's dementia patients. It's crazy.
So it's one of those things that everything is connected.
Yep.
There's dots connecting everywhere back to the same bad guys. And those same bad guys are there and they can form their armies and their assemblies because the good guys are missing.
I love the book Missing Microbes. I also love the book Let Them Eat Dirt. These are books written for the public. They're pretty sophisticated health books, but if you, a parent, are on this podcast and you're finding Mark fascinating, which we do, you're going to want to look at those kinds of books that are written just for you. So,
A colleague who he and I were very close for quite some time, he would always take his young kids to a farm every time he could, just to be exposed to all the variety of dust from the animals and let them play with the cows and the pigs and hogs and you have to be careful playing with the hogs. Never mind that. They can be really mean and vicious. But playing with sheep. Okay, there you go, sheep.
There you go.
Yeah, and he spent a lot of time doing that. And I told you my kids traveled everywhere. I just take them as many places, get them outside as much as you can.
outside.
Outside. Ban the inside stuff. No, I'm sorry, no more tablet. You're going outside the rest of the day.
Outside to play and explore, and they can explore everything except we don't really want them playing with animal feces because
Oh, I
of
know. Yeah,
this.
yeah.
Yeah, so watch your
It's
sandbox.
properly
things
cooked.
like that. Right.
That's a bad joke.
Oh my
I
gosh.
I wondered if I heard that correctly.
So bad. So bad. But talk about the variety of increasing the variety of foods, because you do that purposely for yourself. And there's this whole sort of thought that baby-led weaning is a new thing. It's actually a throwback to old times.
Yeah. Oh, yeah. That's what we did. I'll never. My family will never forget this. We were at a Cajun restaurant, and they used to have some really good kids meals at this Cajun restaurant. And I asked a waiter, "Oh, well, take the kids crawfish etouffee, for the 2-year-old." And he goes, "Oh, we don't have the crawfish etouffee as a kids meal anymore." I go, "What? Why not? How about the pontchartrain?" He goes, "No, we don't have that as a kids anymore, but we do have like grilled cheese sandwich and a hot dog." I go, "No, we're at a Cajun restaurant. We're eating Creole. I'm not going to have them grow up eating hot dogs. And I mean, you get a good Chicago hot dog. That's different. Okay. Right now, Chicago hot dog, as you know, has a salad on top, right? You think Chicago hot dogs. That's different. Okay, that's a different story.
Oh,
And
you're
don't you
funny.
dare put ketchup on it. It's mustard only for the rich ingredients. So anyway, I talked to the manager and I told him why he put it back on. And he later on, we're there eating, like we'd go there like maybe once a month. And he came out and he said, "More people have thanked me for returning the kids' meals the way they were."
Yeah.
Of course, who talked you into doing it? You became another Me Too type restaurant. In
Puppet for
life,
the industry, right?
right? In life, you don't want to be a Me Too. You want to be on a scale of your own.
No, so we really need to help parents learn how to get back to eating real food and
Yes.
just say no to ultra processed food. And earlier in the podcast series, Rob Lustig spoke to us as well about
Oh, yeah.
uh, he's great and talked to us really about the dangers of ultra processed food. But it's probably the number one contributor to the
Hmm.
depletion of the gut microbiome in the history of the human race, the 200 to 300,000 year history of the human race, the number one detriment. And we just need to get that through our brains. We're letting the food manufacturers win, and they're
Yeah.
beating us at health, and it's sad.
It's
And
almost like you hear the people talk about, like, is there some type of evil cabal where you have the big pharma in association with the food, with big agra, because they're making lots of money,
yeah,
and we're paying for it in our healthcare. Our healthcare costs are outrageous in the United States. And you and I, we're in healthcare. We know the costs are outrageous, and we shouldn't have it that way. We're hurting everyone. We're hurting our kids, our grandkids. We're hurting our great grandkids. We need to stop it now, and that's why I'm a cheerleader.
I love it. I love it.
Mary.
Super fascinating. Lauren, do you have any last minute questions for Mark that you are dying to have answered?
Got 100 that we'll need a different episode for. I want to keep going in deeper with everything because it's just and I want to go run and check all my toothpaste and shampoo
Oh
and
yeah, look out for the SLS. I mean, that's number one. And kids, they swallow toothpaste. I mean, we had so many kids who had injuries from swallowing the Crest Sparkles when it had that first plastic bead in it. I mean, it's just,
We
wow.
want
it was,
we want
dentists called
kids
that out.
using soap and water on their hands too, not hand sanitizers.
Oh
Anything
yeah.
that says kills 99% of all bacteria, you don't want that.
Oh, thank you for reminding me.
Yeah,
What's the number one best soap to use in the world?
Ivory? What?
African black soap from Ghana.
Really?
100%. I swear by that. Is a soap that's been around for thousands and thousands of years, although they modified it a few hundred years ago when they added coconut to it. But it was originally just shea leaves and palm and shea leaves,
Wow.
palm leaves. They would dry them out. This is how it's been done for thousands of years in the hot sun. They would pick up all the microbiome from the soil, all the good SBO, soil-based organisms. Then they would boil it in a pot and become this brown paste. And then they would take some of the burning leaves, because they heat the pot that way with the burning leaves too, crumble up the ashes and put it inside. Now, recently, a few hundred years ago, that's very recent, by the way, they added coconut to it. That soap is phenomenal. It's called
Love it.
African black soap.
And how do you buy it?
You have to look around. It's around. I buy it at all sorts of local Chicago fairs because there's always people selling stuff from Ghana. Uh,
African
the-
black soap. Huh?
yeah, African black soap. It helps your skin like you cannot believe. It is so simple in ingredients, and everyone who tries it has gotten back to me saying, "Oh my God, my kid's eczema is so much better. Everything's so much better." I go, it's really weird because you can use the Ghana, for some reason it has to be Ghana, the Ghana African shea butter, and it does as good as a prescription product on your skin, getting rid of stuff. I'll get in trouble for saying that.
I
So,
got to tell you something, inside scoop here, and we'll kind of close. But we had my son Hunter, who's kind of a star in the. I don't know if you had a chance to read Brave Parent, but there's a lot of fun, interesting stories about Hunter, and he did a beautiful job on this podcast. But Hunter is an outdoors guy, right? He lives and makes his living, as a guide and a river guide and a competitive skier, and he's an outdoors guy. And he does not use shampoo. And when he first started this, because he went to Patagonia, South America for the National Outdoor Leadership School, was gone for a whole semester. And of course, they didn't take soap. They took,
mhm.
they didn't. So he came home and he said, I'm just going to do this for a while. He washes his hair with hot water. And takes, when he's in bounds, when he's standing under a shower, when he has access to that, of course, he's always, he's clean. And you would not know that he doesn't use shampoo unless you smell his hair. Now, I said to him, your hair doesn't smell pretty. And he goes, no, Mom, it smells like a human. He said, but my hair is naturally nice like this. He has, beautiful hair because he says, my skin doesn't have to produce more oil because I'm not drying it all the time.
Absolutely the truth. There was a biochemist years ago, Dr. Cornell Marsh, I'll mention his name, who used to work, he told me this, he used to work for a big hand lotion company before he went strictly into research and teaching. And one of the things they were doing with their hand lotions where they were trying to develop hand lotions that would shut down your own oil glands to dry out your skin, so you have to keep using the hand lotion.
That's what you said about the hair.
Yeah,
We
it
know,
was.
that's why we put sugar in food, because we know it messes with appetite
It
hormones.
makes you eat more. Yeah. You want more. Yeah. You'll buy a bigger size next time. Yeah,
I
exactly.
had to laugh because, we spend more on hair products than all of dentistry.
Oh, I know. Well,
Yeah.
cosmetics are
Yeah.
so huge. I
Yeah.
mean, that's where you make your money. And no, I don't use a shampoo either. I just use I use a little African black soap,
Yeah.
and then that's all I use, period. And then I use the shea butter because I have really bad psoriasis.
Yeah.
But my psoriasis, I'm off all meds because I'm using these natural products, which
Love
actually as good
I
as
make my own butter,
prescription.
so I'll send you some skin butter that's super natural.
Yeah, this you can get it all whipped up, and they whiten it when they whip it up for you too. But I mean,
I used to
just
make it all
try it for
myself.
fun. If it
Exactly.
doesn't work, it doesn't work. You're not out what, $3?
Right.
It's
Well,
cheap.
we forget that our skin's an organ and it absorbs all this commercial
Oh
crap.
yeah. You might as well be absorbing something you've been absorbing for hundreds of thousands of years, right?
Exactly. All right. I know we could go on and on. We're at the top of the hour. I can't thank you enough, Mark. And I know,
No
Lauren.
problem. It's been a lot of fun. Very nice meeting you, Lauren.
Here's what Lauren's going to do this afternoon. She's going to get off this in about an hour. I'm going to hear from her like, I'm so driven by this. I can't stop thinking about this. I need to do more of this stuff. So she's just been
Already
turned
working.
on. So interesting, right?
Yeah, it's fascinating.
I hope that all the parents have had a significant impact today listening to Mark. I certainly am just always hungry for more and more and more Mark Cannon, as well as most of my colleagues. So thank you so incredibly much for being with
Well,
us.
thank you for having me. It's been a lot of fun.
Thank you for listening to the Brave Parent podcast with your host, Dr. Susan Maples, author of Brave Parent, and Lauren Eckert, founder of Burning Soul Press. Be sure to leave a podcast review and grab your copy of Brave Parent on Amazon or Audible or wherever you choose to buy your books. Bye for now.